Hello everyone, welcome back to ALifeLearned. Today I'm going to be working with my new YouTube friend Frank, who has ADHD, and with me having PTSD, we're going to work together to compare and contrast these two conditions and discuss how they can be confused with each other. There he is, so stick around to learn more.
An idea can escape. Ideas are bulletproof.
So if you've been subscribed to me for a little while, you might remember that I recently did a video on the difficulty of concentrating with PTSD. You can check it out up here if you want and haven't seen it yet. But in that video, I did mention that PTSD has actually been confused or misdiagnosed with ADHD.
What's up, good people? My name is Frank Domenic, and as Becca mentioned, I have ADHD. Sometimes ADHD and PTSD get mistaken for one another, and that's because they have a lot of similar symptoms. This includes symptoms such as poor memory, lack of attention, poor memory, restlessness, impatience, impulsiveness, and poor memory.
As well as sleeping issues, anxiety, depression, low esteem, anger issues, addiction problems, and even shame. But these conditions are actually rather distinct from each other in that PTSD is an anxiety condition that develops from experiencing or being exposed to some kind of traumatic event.
Whereas the actual cause of ADHD isn't known, and no, it's not dietary. Feeding your child a bunch of sugar will not make them hyper and give them ADHD. There are a couple things that make your brain look different. What scientists do understand is that there's differences observed in three areas of the brain between somebody who is normal and somebody who has ADHD. These three differences are physical, chemical, and functional, which basically means the overall structure and operation of the brain is different. There are actually two types of ADHD, one that's more of an impulsive response and one that's more of a hyperactive response. And if you're somebody like me, you're just a lot of both. The inattentive side of ADHD is the one that's more likely to be confused with PTSD, and the hyperactive one is the one that's actually more likely to be overdiagnosed by doctors. You know, whenever you hear in the news about how many people who are getting diagnosed with ADHD but don't actually have ADHD, it's probably somebody who's just a little bit more hyper than the normal kid, but they might not actually have full-on blown ADHD.
But though these symptoms are similar in appearance, their causes are actually rather different for each condition. So where all of the symptoms that are experienced by someone with ADHD are basically the result of the structural, functional, and chemical differences that they have within their brain, for someone with PTSD, it's more related to the chemical differences that are the results of the trauma, and these symptoms tend to come out as a result of a lot of different experiences from someone having PTSD. So with someone who has faced a trauma, they might have a lack of attention as a result of being triggered in some way and experiencing a flashback, or maybe they're trying to avoid an excess of stimulus because that in itself is triggering to them, which means that they're shutting down and numbing. It can seem like a lack of attention when really they're just not there at all. Or very similarly, they can often be having the overall experience of hyperarousal, which can be the result of many different things and can lead to a lot of the different symptoms that we mentioned, such as impulsivity, anger, poor memory and concentration, as well as lack of sleep.
Side note, the absolute worst thing in the world for me is to be at a mall, because the problem is that there's so many people walking around and there's so many faces to look at. You see, there's this thing where I like to always look at people's faces because I like to be situationally aware of what's going on around me. And I also always in the back of my head, I'm always thinking, oh, if there's somebody around me who I know, I always want to go over and say hi. So malls are the worst place in the world because there's like hundreds of people walking around. I'm constantly looking at every single face. It's overload. This is very similar to hypervigilance, which somebody who has PTSD might suffer from. Essentially, it's the exact same thing, but more of a fear response. So seeing as these conditions have similar symptoms, but for different reasons, it's obvious to see why there's a lot of misdiagnosis between the two, because they carry a lot of similarities as well as similar treatments, but there's also differences, of course.
The main similarity is that both conditions are actually treated with cognitive behavioral therapy, though PTSD is actually more trauma-based. And of course, both conditions benefit from proper diet and exercise within life, as anyone's mental health really would, because that's just a good way to keep yourself healthy in general, but it does help in managing these two conditions.
On top of CBT, those with ADHD like me are sometimes prescribed ADHD medications, which are usually stimulants. This is like Ritalin, Concerta, and Adderall. My personal favorite is Ritalin. I used it from grade 1 until like grade 6, and then I tried Concerta for a couple years, didn't like it, went back to Ritalin. I've been using it ever since, and it works perfectly with me. But there are some really noticeable side effects, like if you take it too close to bedtime, you won't be able to go to sleep, and a suppressed appetite. On the other hand, those with PTSD are sometimes prescribed a variety of things, and this has to do with the fact that there's a lot of secondary symptoms that need to be taken care of, such as depression, anxiety, OCD, or many other conditions.
But a final and very important note to be aware of is that it's very possible and actually not uncommon to have both conditions, or to just have PTSD, but to only have your attention deficit symptoms recognized.
An ADHD ADHD diagnosis does not routinely involve evaluating past traumatic events. So if you think that there was a chance that your ADHD was misdiagnosed for PTSD, or at least diagnosed with a neglect of past traumas, definitely speak to your doctor and get it checked out.
It's never a bad idea to check up on your mental health and make sure that you have the proper diagnoses and thus are receiving the proper treatment. So I hope you found help in this video in terms of distinguishing between PTSD and ADHD. Thank you so much, Frank, for helping me and share this information with everyone. Please, everybody, go check out his channel. He's got a lot of really cool content. I don't know if you noticed, but he's pretty funny too, so be sure to check him out. I'll put his link down in the comments below, and as always, please comment about anything you might have to add about this subject, and join me again next week where I try again to share a little something I've learned in life.